Autism presents with developmental deficits involving communication, motor, and behavior. Whether having an autistic child or coming in contact with ones holding this diagnosis, becoming aware of the developmental challenges and knowing how to improve and assist these children in this area needs to improve. Autistic Spectrum, published by Wikipedia contributors of Wikipedia, the Free Encyclopedia, today defines autism as a range of neurodevelopmental conditions generally characterized by difficulties in social interaction and communication, repetitive behaviors, intense interest, and unusual responses. Autism has become more prevalent amongst our children, especially in the Galveston County community. Hello, my name is Melissa Acord. Autism can be defined and diagnosed by one presenting with social delays involving communication, gross motor skills, and behavioral challenges. Today, I want to highlight these areas involving social delays and how we can help to manage and assist children holding this diagnosis. First, we will discuss communication delays involving autism. Then we will explore delays with motor developmental areas, and then we will discuss fine and motor skills. Finally, we will discuss behavioral challenges and anxiety the autistic children deal with on a day-to-day basis. If you are a parent of an autistic child or teen, plan to have children, or work with autistic children, this topic may motivate you to want to become more aware and learn about social challenges that you may be an influence to these wonderful minds. Having a child diagnosed at an early age of autism, I have personally seen how the lack of understanding my son's social challenges and cues in the school environment and in the public environment can lead and affected his emotional growth. Having a deep understanding of what autistic children struggle with in the area involving their social skills will help you to interact and become more aware of what assistance is needed by you. Autistic children tend to fall behind their peers in social skills involving communication. Communication deficits and social delays are a common issue amongst autistic children. An article published by Dr. Mark Burden in a 2022 issue of Autism and ADHD, the Complete Playbook for Social Challenges, stated, lack of social skills can appear as early as 6 months. Most children on the autism spectrum benefit from speech delay. Speech delay is very common, but speech regression can also occur. Speech regression is when a child seems to be developing as a normal child, saying new words, and even may start communication, then suddenly just stops talking. Communication skills may not only involve verbal, but also nonverbal. Most autistic children tend to struggle to read facial expressions, understand others' humor, and lack the knowledge and skills to understand nonverbal cues involving feelings. A verbal communication deficit in autism includes E. coli. E. coli is scripted, repetitive, or awkward speaking. Serena Weider published an article in 2018, Motor Development on How Autism Affects Motor Skills, stated, moving our bodies throughout our day-to-day lives is something most of us do without giving it much thought. But did you know it takes a considerable amount of skill? Children with autism deal with deficits in the fine and gross motor delay. Perfectum organization published in 2018 Motor Development Autism Journal stated that studies suggest autistic children could be 6 months behind on gross motor skills and up to a year behind in fine motor skills. Central nervous system controls both fine and gross motor skills. Neurological differences in autistic children may be explained due to the neurological differences and struggles with sensory processing. Sensory deficits can impact both fine and motor skills. Fine motor is anything that relies on using small muscles in the hands, and gross motor is anything on balance, body awareness, and motor control. Writing and drawing may be a challenge to autistic children. Having an unusual pencil grasp may not be as important to teach to a normal pencil grasp as it may be to teach an autistic child how to write their name. Assistance may be needed when learning to do simple tasks such as buttoning a shirt, tying a shoe, or zipping a zipper. Occupational therapy can be beneficial in addressing delays with motor development. Just as motor developmental deficit may present as a delay but can be improved over time, autism also presents with behavioral and emotional challenges. But with assistance and patience, this deficit can improve over time. Behavioral challenges may include refusing or ignoring simple requests. Sometimes when an autistic child doesn't understand something, it may be easier for them just to ignore the request. Autistic children do not adjust well to schedule changes or disruptions in daily routine. This may cause them to act out. ABA therapy employs the behavior consequence of ABC to improve behavior. A, make a request. B, child complies. C, reward the decision. This approach can help to increase positive behavior and reduce challenging ones. An article released June 2020 by Raising Children stated reducing a child's anxiety may reduce the behavior associated with the core characteristics of autism, but it won't get rid of the characteristics or behavior. Autistic children feel many of the same worries and fears as other children, but also worry or stress over things that a typical developed child wouldn't. Social situations and thoughts of past experiences may disrupt an autistic child's entire day. Autism presents with delays in social, motor, and behavior development. Let's look at what we discussed. Understanding autism and recognizing their social cues will in turn lead to better communication and give much needed support that they need. Not addressing social delays in autism can lead to problems with friendship, romantic relationship, areas involving daily living or day-to-day tasks, education, and employment. First, we learned about delays in social communication. Then we discussed deficits involving fine and gross motor skills. Then we learned about behavioral challenges that occur in autism. Autism presents with challenges and struggles that children go through as they progress through their life. My son has taught me so much as he has struggled in all three of the areas we discussed. His goals and motivation to continue through life despite his diagnosis of autism, nor his challenges he faces every day, amaze me every day as I see him mature into a wonderful and young teen boy. Thank you for taking the time to learn about something very dear to my heart.